never know. I am angry. Stop it. Come on. How could someone not know they're pregnant? I loved this episode. It's everybody's favorite time of the month. Much better than that other time of the month where we review an episode of TLC's famously entertaining I Didn't Know I Was Pregnant and ruin it with educational commentary. This episode has quite possibly one of my favorite moments in us reviewing these on this channel, which that is a history that goes back some 3+ years now. If you're a big fan of me reacting to these, you're going to be a real big fan of something that happens in this episode.
In 1999, undergoing surgery for ovarian cysts, 26-year-old Angel is diagnosed with endometriosis.
What they're discussing is her having a surgery that was for an ovarian cyst, and at the time they identified endometriosis in her pelvis. Endometriosis is endometrial glands, which should be on the inside of the uterus, the endometrium, the lining of the uterus, which have become transplanted outside of the uterus for some reason. The most common place endometriosis is found is in the pelvis. However, endometriosis is a very bizarre disease that we don't fully understand. There's probably some element of lymphatic spread as well, similar to a cancer, because we have found it in weird places like the lung and the brain.
I was experiencing the heavy bleeding and extreme pain.
And we were pretty much told the chance of her conceiving was slim to none.
It is devastating to hear someone tell you can't have children.
If you are a doctor or a healthcare provider of some kind, stop telling people that they can't get pregnant. When you say to someone, your chances are slim to none, you imply to them that they don't need to protect themselves against pregnancy if they would like to not become pregnant. It is true. With endometriosis, you are more likely to have infertility or difficulty conceiving. 100% true, okay? However, a lot of people with endometriosis go on to get pregnant and have a baby. This is very similar to PCOS in that I see people told you can't get pregnant with PCOS. You can. You have an increased chance of infertility, but please, if you don't want to be pregnant, protect yourself no matter what the doctor said to you about it, because that's not accurate.
Angel manages to beat the odds.
Honey?
She gets pregnant in 2003.
We're pregnant. We're pregnant!
Are you sure?
Yes, honey, look!
Oh my gosh, the actors are usually so terrible. I'm gonna cry. I believe her. She is pregnant and she's wanted to be for a long time.
Angel is diligent about prenatal care. Unfortunately, Angel develops dangerously high blood pressure and has to undergo an emergency C-section.
Hunter was 6 weeks premature.
Hunter would spend 2 weeks in the NICU fighting for his life before he is finally strong enough to go home.
I did not want any more children. I cannot go through what I went through with Hunter.
Preterm delivery, which was caused by dangerously high blood pressure, which could be just high blood pressure related to pregnancy, could also be something called preeclampsia, where you get elevated blood pressures and you also have protein in your urine. This can cause very serious complications, including seizures, maternal stroke, abruption where the placenta comes off the side of the uterus. It is a very dangerous complication. For people who had preeclampsia in the past and know that they want to get pregnant again, there are things we can do to reduce your risk of preeclampsia in future pregnancies. And one of those things is a daily aspirin and magnesium and calcium supplements starting early in pregnancy, as guided by the person who is taking care of you, of course.
While Hunter recovers, Angel's health declines. Just a year later, in 2004, her endometriosis returns with a vengeance.
It was so painful, it felt like knives in my stomach.
She would cry because she'd be in so much pain.
In February of 2008, Angel gives up all hope of having more children and schedules a hysterectomy for that October.
I didn't want any more children, and it would stop all my pain.
A simple hysterectomy does not always guarantee endometriosis pain will completely resolve. There are some patients who a hysterectomy, particularly if the ovaries are also taken out, will have an improvement in their pain. I would not say that hysterectomy would ever be something I told a patient with endometriosis. Doing this will definitely make your pain go away.
While she waits the 10 months for the operation, Angel continues taking birth control pills and is also put on a hormone medication.
Given how old this video is, it sounds like they probably had her on a medication called Lupron. This is an injectable medication that basically shuts down the ovaries, where you are essentially put into a pseudo postmenopausal state. By decreasing all of that estrogen, you decrease inflammation that comes along with those endometrial implants that are other places, because estrogen stimulates them. That is an effective treatment, but it is not a long-term solution, and also is not effective for everybody with endometriosis. But it sounds like she was getting good results from that. She also was on a birth control pill, and that's an interesting combination. Regardless, she said she's on a birth control pill and an injectable medication, which I think is probably some kind of GnRH agonist medication.
After 10 months of waiting, Angel is scheduled for her hysterectomy. On the morning of October 14th, 2008, Angel undergoes her final pre-op exam and receives stunning news.
No, she is not going to show up for her hysterectomy after being on that medication and birth control pills pregnant. Stop it. That would be incredibly, incredibly rare. If she's actually on that medication I said and a birth control pill and she ovulated and got pregnant, I can't medically explain that.
My doctor said, "Oh my, it's the tumor." I cried because I thought, this is it. I've got cancer.
Surely he didn't really say that. Oh my, it's the tumor. Okay, I'm not making fun of her. I am making fun of her doctor if that is actually what they said, because come on.
That afternoon, a terrified Angel goes in for the ultrasound to confirm the diagnosis.
You said you're scheduled for a hysterectomy on Monday?
Yeah.
I don't think that's gonna happen. You're about 4 weeks away from having a baby. What?
It drives me nuts how they always have the heartbeat running in the background the entire time the ultrasound is being done. Before the probe is even on her abdomen.
That afternoon, a terrified Angel goes in for the ultrasound.
I don't know, what could it be?
You're about 4 weeks away from having a baby. What?
That ultrasound is of a fetal face. So yeah, I mean, I don't know how she knows that she's 4 weeks away from having a baby by a quick look at the face. And I also don't know how she is continuously listening to the heartbeat throughout that entire exam with the probe on the face. TLC has magic medicine, so I can't question it.
Angel learns that what her doctor thought might be a cancerous tumor was in fact a baby. She is at least 36 weeks pregnant and didn't even know it.
36 weeks means she got pregnant probably right before she started that medication. Obviously, we don't have exact numbers, but she probably ovulated just in very close proximity to getting the medication, either immediately before or after. That's the only way that this can make sense in my head.
Her lack of prenatal care, in combination with her endometriosis medications, may have harmed the baby.
I'm not sure what the medication actually causes as a side effect. I would imagine there are some hormonal and developmental issues that could come along with that medication. And I think we're going to have to jump into, the typical spiel in a moment, but I'll let her finish talking.
Angel then undergoes a series of tests to assess the health of the baby. The results are chilling.
I'm not seeing any amniotic fluid.
Angel is stunned. She didn't even know that she was pregnant, and now her surprise baby is in jeopardy.
Amniotic fluid is essential for your baby's nourishment. Right now, your baby's getting none.
Okay. I'm sorry. No amniotic fluid is sometimes a really concerning thing, but it never is a, pants on fire emergency at diagnosis. Having no amniotic fluid, depending at the point in development when it started, can tell you what the problem is, or it can be a symptom of the problem, or it can cause other problems. So early in pregnancy, you need amniotic fluid to develop the lungs. As you move through the pregnancy, if there's no amniotic fluid, it could be a sign that the fetus has not developed any kidneys. If you've had a relatively normal progression of the pregnancy, which admittedly she doesn't know if she has or not, and then you get towards the end of pregnancy and there's no amniotic fluid or very low amniotic fluid, it can be a sign of preeclampsia, like she's had in the past, that is affecting the function of the placenta. I would absolutely not say no amniotic fluid means your baby's not getting any nourishment, because that is not accurate. It's not accurate.
He said, we're going to have to deliver right now. They had to do an emergency C-section. I was real concerned about that.
There's a lot of things could go wrong at this point.
You'll be okay.
Angel is rushed into surgery.
This would never happen like that, purely because of low amniotic fluid and a just diagnosed unknown pregnancy. It's concerning, and you need to figure out why and how far along you are and what the best thing to do is, but this is silly. And I want to make a note that I'm not questioning the sequence of events that the person who had this happen to them is telling. I'm questioning if there was something else that was going on that made it a pants on fire emergency, or if it has been dramatized for the TV show.
How you feeling, Angel?
Okay. It seemed like a long time, but it was just seconds.
Congratulations, Angel, on the 6-month-old baby that you just delivered on the TLC show. Obviously speaking to actor Angel, not real Angel. I'm sorry, I can't be serious today. This is so dramatic. It's not usually this dramatic, but that's a very cute baby that they have, and it's definitely been alive more than 30 seconds. I know. Every time I say that, people are like, what, do you want him to get a newborn? No, I'm not. I'm just pointing out the inaccuracies. That's the whole point.
Estimated to be born at 38 weeks, Hannah Noel appears to be healthy in spite of her lack of prenatal care.
She had no complications at birth, but they didn't know if there was going to be any disabilities.
I need to say what we always say at this point in the programming. Say it with me now. You do the best you can with the information that you have. It is reasonable to look back over the pregnancy and think, what could I have done differently? Oh my gosh, why didn't I know? I feel so guilty. I didn't get care. You didn't do this on purpose. It's like with everything in life. When you make a decision and you don't have all the information you need to make the best decision, you can't get that information, look back, and be angry at yourself for making a decision that you wouldn't make if you knew what you know now.
4 months later, Angel and Tim's worst fears come true. Hannah has developed disturbing symptoms.
She wasn't reaching for anything. Her muscles were extremely stiff.
Hannah's lack of prenatal care could have caused a debilitating condition. Her baby might have cerebral palsy.
Stop it! Stop it! I am angry. That is not what causes cerebral palsy. Why would you do that to people? Prenatal care is important, but not getting prenatal care is not the cause of cerebral palsy, okay? That's a really cute baby. I hope everything turns out fine, but that made me angry.
Hannah undergoes a CAT scan to help verify the diagnosis.
The causes of cerebral palsy is lack of prenatal care. I wish I could have had the prenatal vitamins and everything. I blamed myself.
Okay, before they get the information, I need to say, this is terrible. It is terrible that this person has been led to believe that lack of prenatal care is a cause of cerebral palsy and that they feel like if this is what is going on, that they caused it. Sometimes babies are born and they have cerebral palsy. We don't even know what caused it. Probably most commonly, a hypoxic event, meaning the blood flow to the baby is causing a lack of oxygen. Prenatal care may be associated with a lower incidence of cerebral palsy because you might be able to catch one of the complications that's happening sooner. Not getting prenatal care does not cause cerebral palsy. We have a person who didn't know they were pregnant for what I would say is a very good reason, and subsequently was told that not getting prenatal care caused this. How about not knowing you were pregnant caused you not to get prenatal care? That doesn't even take into account people who don't have access to prenatal care. This just, my gosh, this video is gonna be way too long for a didn't know I was pregnant reaction, but this just makes me angry.
And then we get a telephone call.
Thank you so much. Thank you. Okay, goodbye. She's fine. She's good.
They were like, your child is in perfect health. At that point, I start hooting and hollering. I look over my wife, she starts crying.
Within months, Hannah loses the stiffness in her limbs and motor skills develop normally. Angel is overjoyed that the little girl she didn't even know she was carrying is now healthy and thriving.
It's normal to celebrate if you think something is going on with your child and then you get good news. At the same time, cerebral palsy is not always something that is absolutely devastating and does not have to be looked at through a lens of being a utterly life-devastating consequence or problem that you have. It can be in certain situations, but many people live very full, happy lives with cerebral palsy. That is not meant to minimize the struggles that some people who live with cerebral palsy have, but only to say that the reaction is normal, and we also should acknowledge that it doesn't always have to be a diagnosis that I don't know how to say this. The whole point is a lot of people live very happy, full lives with many degrees of cerebral palsy. And I just feel like it was important to throw that in.
Show, it's about...
Ironically, Angel had seen an episode of I Didn't Know I Was Pregnant just a few weeks before Hannah's birth.
Mama, seriously.
There's a program on there, and those women are pregnant, don't know it. It has to be made up.
Looked at her, I said, that's just not possible.
How could anybody be so stupid to not know they're pregnant?
That is the best thing that has ever happened in any of these episodes. Did you hear her? She said what all of you say in the comments. How could someone not know they're pregnant? Yeah, we're talking about it here. This is how it happens. I love that so much. Oh my God, it's so funny. Next time someone comments, I'm just gonna comment with a link to this part of this video. I loved this episode. Don't judge people, because You never know. You just never know. You might go into labor tomorrow. If anything changes, take a pregnancy test.